I was paralyzed for a year after a chloroquine injection at age 4. My dream was to be a healthcare provider who would provide the best care for my patients. During my first pregnancy, I was carrying twins and was 37 weeks along while I was on my clinical rotation in the labor and delivery ward. I was helping to treat a woman experiencing postpartum hemorrhage. She unexpectedly kicked me in the abdomen. I felt immediate pain. I began to bleed vaginally and went into labor. An ultrasound revealed that one of the twins had no heartbeat. I was rushed to the regional hospital, where I learned that I was already 8 cm dilated. I realized my labor was progressing more quickly than usual, and the contractions were becoming increasingly intense. After spending 30 minutes in the ward, I felt a strong urge to push. I called out to the nurse's attention, but to my surprise, she shouted back that it wasn't time yet. I explained my situation to her, but her response was, "At least you are lucky that one twin has a heartbeat. Stop shouting and behave yourself." I was shocked by her reaction. Once again, I felt the urge to push. I called out again to the nurse, and she stormed in, annoyed and complaining. When I opened my legs and she saw the baby's head, she finally believed that I wasn't just seeking unnecessary attention. Soon, the midwife and physician arrived. The physician decided to perform an emergency cesarean section to save the other baby, whose heartbeat was dropping. While being wheeled into the operating theater, I felt the urge to push again. I delivered the first twin, but there was no cry. After a few minutes, the second twin was born, and she also did not cry. I felt my world collapsing around me. Finally, I heard a tiny cry, filling my heart with hope. That was when I vowed to become a healthcare provider who brings peace to women during such difficult moments. Ultimately, I became a physician assistant. The first 2 years were rewarding as I treated patients as I hoped to be treated. Then COVID-19 struck. I spent a month working in the hospital, caring for patients at their bedside. But after the pandemic, I missed the one on one interaction and being actively involved in their care. I felt burnout and disconnected from my work. Although everything had returned to normal, I missed the bedside care. That's when the thought struck me. Nursing school. I knew I wanted to become a labor and delivery nurse.